Director of Admissions and Enrollment Management Services for Wayne State University. And I just wanted to step in quickly to this call. I have another meeting I have to move over to. So I'll hand it off to Dr. Kevin Sprague, our Dean of Admissions, and Abhi Krishnan, our Associate Director of Admissions. But I wanted to tell everyone thank you for stopping in, and in these times of uncertainty, thanks for hanging in there with us, and hopefully we can provide you with some valuable updates today. Dr. Sprague?
Okay, thank you, Jamie. I'm Kevin Sprague, the Associate Dean of Admissions, and I want to give you a little bit about my background. I graduated from Wayne State School of Medicine in 1980, completed my residency in 1985 in orthopedics, and I've always been involved in the school through the Alumni Board of Visitors in the last 10 years in the admissions department. We have a great team. You'll meet, you met Jamie, you'll meet Abhi, and everybody knows Dawn. She's been here. She's an excellent resource for everybody. And I would also like to thank you for all your hard work advising pre-med students in the application cycle. And you've sent many excellent applicants over the years who have made excellent physicians. So your dedication and work up front has assisted us greatly. And with that, I'd like to, Abhi available.
Thank you for that introduction, Dr. Sprague. Hi, everybody. My name is Abhi Krishnan, and I'm the Associate Director of Admissions at Wayne State University School of Medicine. We're going to keep this presentation pretty short and to the point. Before we get started, just a little bit of housekeeping. I'm sure we're all zoomed out at this point and are completely aware of this functionality, but nevertheless, we're going to have a question and answer session at the end of this webinar. Ergo, if you have any questions at the end of the presentation, please use the raise your hand feature so that we may unmute you. And if so willing, please turn on your microphone and or video. You can always write out your questions to us in the chat box and we will read them as they come. So to begin the presentation, these truly have been pretty challenging times. In a school housed at the epicenter of the state with one of the highest number of COVID-19 cases in the country, we've been significantly impacted by this crisis. And as such, it has affected our entire admissions network. This includes students in their preparation for medical school, advisors and admissions staff, and our physicians and first responders. And to discuss this more in detail, I'm going to hand off to our admissions supervisor, Dawn Yargeau, who has really been working with our department for over 25 years and has a wealth of knowledge and wisdom that she'd like to impart to you. Dawn.
Sorry, I realized that I was muted. So I wanted to, so for those of you that don't know me, my name is Dawn Yargeau. I have been in the admissions office at Wayne State for almost 27 years now. So over a quarter of a century. Time flies. I know many of you, and I'm glad to see that you're on here. I'll wave to all of you that I know. So how is Wayne State School of Medicine admissions responding? So we're trying to be as highly flexible as we can be. As far as prerequisite coursework, typically, while we don't accept online coursework unless it comes from their home institution, we are accepting online courses even from other four-year colleges or universities. We would hope that candidates will select courses that can be graded as opposed to pass-fail if that option is available. We know that some schools are giving that option and some are not. Application timelines, we do not expect any changes whatsoever to our EDP at this time, but we do know that applications will not be received by Wayne State until July 10th. That's a 2-week delay, and that is AMCAS's timeline. We do not expect our application timeline to change at all. We still end on December 31st. Highly flexible as far as our secondary applications. We do have new questions this year. I'm sure you'll find them out as soon as the first apps start going out. We are adding an essay questions for students to discuss how they were impacted by COVID-19 disruptions and what their future outlook in medicine is. So we're looking forward to kind of seeing how students did respond to it. MCAT, we are going to accept any MCAT that is currently offered by AAMC in 2020. For right now, students can apply without having an MCAT, but we will want to see that MCAT score before they will be eligible for an interview. We do accept MCATs from 2017 through September of 2020. As of right now, MCAT has not added October, November dates. We will decide that if the time comes. We are prepared to rapidly change as we have done so far. I think we've been pretty consistent with trying to keep up to date. We are definitely planning on virtual interviews for the 2021 entering class. We want to be consistent across the board and make sure that students are getting the same experience. So we couldn't switch in the middle of the year, so we are strictly going virtual. That will include a faculty interview, medical student interview, as well as MMI stations. They will all be conducted through our AMP system using Zoom functionality. So we think most students have access to that. And we will deal with any accessibility issues as they arise. We are hoping to provide additional opportunities for students to engage and get to know us, but those are still to be determined as our students transition back into the classrooms. And I'm going to turn it back over to Abby.
Thanks, Dawn. So changing gears just a little bit. So to update you on changes for our current incoming class, tentatively we are planning and preparing for online learning on July 13th and in-person on-campus learning at the end of August. We're excited to announce that Dr. Mark Schweitzer will be providing leadership and direction as our new dean. As such, he has formulated a task force for the resumption of medical school operations, and we will provide more details to this and in the coming weeks. So please note here, this is an example and not an expectation, but we wanted to impart to you that our faculty and our students are actively responding to this crisis. At Wayne State University, we're deeply committed to serving our community. And to that end, we've established several community advisory boards that seek to inform leading community members on how to disseminate information quickly and spearhead the charge on health literacy, which has led to greater adherence, lower recidivism, and increased quality of care and life for the citizens of Detroit. Suffice to say, there's numerous clubs and volunteering opportunities that exemplify the diverse interests of our medical students. For example, in response to COVID-19, Wayne State University's Physicians Group and the Access Group has partnered together to help deliver care to our community partners through drive-through testing and mobile provisional testing as well. And their effectiveness has actually been noticed by the CDC and is currently being considered as a novel deployment strategy for city centers across the United States. In times of adversity, we are truly tested, and our medical students have continued to exemplify our mission statement of urban clinical excellence in these uncertain times. So with that, we'd like to say thank you so much for joining us today. Please stay in touch with any questions that you may have. Feel free to email us. And one thing that we do want to mention is that we do have an upcoming student informational event that's coming up on May 28th. And with that, we'd like to close our webinar for today and begin to take any questions that you might have.
Can you share more about virtual interviews as you know it so far? How many MMI stations, length of the interview day? So we're still working on that, particularly working with AMP. But as we know it right now, length of the interview day will be shorter than previous days. We will have anywhere from 3 to 5 stations. We're still working on that part of the equation, but we will still have a faculty interview, probably about 30 to 35 minutes as previously, And also we will have medical student interviews, again, 30 to 35 minutes in totality before we decide what we're doing with MMI stations. And as soon as we have that information, we'll forward it out. Let's see, any other questions coming from anybody? We're open to answering anything.
Hi, this is Terry. Can you hear me?
Yes, Terry, hi.
Hi. What would be your best advice? I've been to a webinar actually at University of Detroit Mercy Dental School, and they talked about, you know, just they were utilizing kind of a pre-interview process where students had spontaneous questions come across the screen, and so they actually answered them. I can't remember the system they were using, but it was kind of like, you know, students sitting at home in their dorm, in their apartment, and doing these interviews. And so they had showed various ones, obviously with permission from the students. So in being an advisor, the first thing I think about is like what they're wearing and their, like what's in the background. So to what extent would you, how should we advise them as far as preparing for this new aspect of professional interviews that they're going to be doing, again, from their dorm, potentially from an apartment, maybe even from home, depending on what's going on in the world. Kind of what is your expectation of them? You know, do you want Black backgrounds as much as possible, or not Black, but, you know, just not their bedroom or people walking in and out, or their pets, you know, jumping in? Just what are some tips we can advise them in preparation for this type of virtual interview?
Abby, do you want to take that?
Yeah, sure. I think that it's important to relay to them that we want them to be as professional as possible and to continue to employ whatever decision making that they would have used for a normal interview process to what they're going to be doing from home. You know, it's entirely up to the students themselves. I mean, we definitely predicate a lot of our anything to do with admissions or anything that's medically related as just being very professional. I think that that's the best way for me to distill that to everyone, is just that if you were going to interview with any medical school and for a job performance, how would you dress? And that would be my first thing that I would mention to them. The second thing, yes, I do think that there are definitely disturbances that can happen behind them, and backgrounds are important, but I would best deliver the message to the student that they should decide on what exactly would be most professional to them. If they feel that having a backdrop that's completely concealing what's happening in the background is most advantageous to them, or if they're in a very high trafficked area, perhaps it's not the best place to conduct their interview. Those are probably some suggestions that I would make to them. But again, one thing that we've been really trying to convey to students is that they're all going to be physicians in training, and they should be very cognizant of the fact that professionalism is definitely something that we engaged on, and that they should plan accordingly.
So I'll answer this really quickly. It came from Tawny. Hi, Tawny. Will these slides be available to us after this session? We are recording this session, and we will be sending you out the recording of this session. At the same time, we'll also be sending you a link to the sign-up form. If you want to invite your students to attend our webinar on May 28th, you'll be more than able to do so. Helen Wilson has a question. I am telling students not to take community college classes online. How will you handle if students do have classes online from community college? Our preference is that they not be the prerequisite courses, but we do understand that some students will be taking community colleges, you know, coursework online. Our preference is not the prereqs. And quickly, for those of you who don't realize or aren't aware of it, our pre-med requirements did change for this year. We still have the same traditional 2 semesters of Gen Bio, 2 semesters of Gen Chem, 2 semesters of Orgo Chem, 2 semesters of Physics. Labs are strongly recommended but not required. And we have changed our English requirement to a writing requirement. So I wanted to get that in there. Krista Coleman. I'm not sure, Krista, I don't know that we've met, but I hope we meet in the future. A lot of my students have been asking for insights about what they can do to continue to enhance their application during this time, especially given that a lot of research clinical opportunities have been canceled. What advice do you have for students, and how will you take this into consideration during this application cycle? Abby, do you want to take that?
Sure. Yeah, absolutely. This is something, I mean, and this is, you know, something that's very similar across the vein of all the slides that we went through today, is that we're being as flexible as possible with these students. I mean, we're completely understanding of the fact that there's a pandemic going around. This is definitely going to impact a lot of students when it comes to not just their decision making when it comes to taking courses or, you know, clubs and activities and volunteerism, but it's also definitely going to impact them and their opportunities that are available. So what we're really suggesting to students is that we're hoping that a lot of students are applying with attributes of longitudinal commitments. We really want to see things, and that's one thing that we've been stressing to students, is just that if you're going to showcase to us the fact that you really want to be a physician, that you know, really having these chronic experiences are really going to be very beneficial for you. And it's something that it's really indicative to the admissions committee when it comes to their competitiveness and how successful they'll be in their trajectory to matriculating as an MD one day. So, you know, we really want them to, I suppose, first of all, showcase all the things that they've been doing in their past, and hopefully not kind of rely on these past 2 months to, you know, finally end up doing physician shadowing and finally end up doing volunteering. That being said, for those students that are looking to, let's say, for instance, open up and join back in their research lab, we've been in partnership talks with our graduate school, and, you know, research activities are slowly beginning to open up within our main campus university and at the School of Medicine. And one thing that we've been told, and one thing that we're telling all of our graduate students, is start writing review papers. You know, being able to you know, sit down and actually begin to learn about different strategies and techniques and analytical skills is something that's really novel when it comes to research, and that's something that they can employ. Number two, when it comes to clubs and activities, I think that right now, I think we've all been faced with, as I mentioned earlier, the like really zoomed out on these activities. But I think that you can still continue to contribute to a lot of those clubs and activities from a virtual presence. That being said, we are a very community-focused driven institution, and a lot of the things that we do are very tangible. And so for that, what we're really suggesting students to do is really just take a more of a positive approach when it comes to how you would meander community service within this type of environment. What we've seen for some of the students that have been applying currently is one such student actually told me that you know, several of their neighbors were senior citizens, and one thing that came up was you know, we'd really like to give back to the community and continue doing community service involvement. And what she did was she went by, she had telephone numbers that she had taken up from all of the senior citizens in her neighborhood. And she went in, you know, went to, I think, a Costco nearby, purchased goods for all of her neighbors, and came back and delivered them. She's been keeping in contact with them. She's been communicating with different pharmacies for their medications. And these are different types of activities that I think students can perform while being indoors and kind of socially isolating themselves from others. I still think that the idea of community service and involvement can be done still within this time, and that's something that we'd like to continue to advise students to approach in that type of way.
Thanks, Abby. So one of the questions was from Catherine. Many of our students have inquired if there's any chance of receiving secondaries prior to July 10th. Unfortunately, we will have no idea who has applied to us until AMCAS starts sending us that data. We do not get preliminary data, so the earliest they'll go out is July 10th. More than likely, our expectation is it will be July 13th at the earliest before we start sending them out, as we get an opportunity for the database to finish loading and to look at the applicant pool. Heidi Lang says, May 28th webinar for all prospective students is geared toward applicants. For the most part, toward applicants, it could be for those who are potentially sophomores. I think it's certainly way too soon for it to be freshmen, but sophomores and juniors would probably be more than welcome to join in on that. How do students sign up for the May 28th webinar? Abby, do you have that link?
Yes, I do. So we're going to be sending that out to students as well, and we'll send it out to the listserv so that you can distribute it to students that you might come across.
Mariella, you had your hand raised.
Oh, yes, please. Hello. First of all, thank you so much for doing this.
Of course.
And I wanted to go back for a moment to the MMIs because, you know, it can be a bit of an intimidating setting anyway, even in person, and will present new challenges in a virtual format. And specifically, I wanted to pick your brain a little bit when it comes to how students should best employ whatever allotted time they're given at each station. You know, one question that we often receive is, you know, what if I have X amount of time, let's say 3 minutes, you know, to answer the question, and I'm done after, you know, a minute and a half. And, you know, do I just stay quiet? Do I keep having conversation? And of course, our advice is always, well, you know, be a human being. So don't just pull out your phone and continue to engage with your audience. Now, in a virtual setting, I suspect that any downtime can be 10 times as awkward if, let's say, a student wraps up an answer before their time is up. So from your perspective, what's best? What should we be telling students on how to allocate their time?
So Mariella, one of the things that I would suggest and of course, we're only speaking for Wayne State School of Medicine. Our MMI interviewers have been trained to fill that void of time. And so for the most part, what happens is once they have answered all the questions, and we tell them this ahead of time, once they've answered the questions, our scorers will say to them, that is all the questions for this scenario. And then they will engage them in just a pleasant conversation. Where'd you come from? You know, that kind of thing, just to find out just a little bit more about them, just to keep it kind of comfortable for them. We do know that this will be a different time. And of course, depending on how much time in the Zoom, perhaps we will end the Zoom meeting earlier. We're still working on that as we determine how many we have. But I think you can only advise them to listen carefully to the directions that are provided to them, because we try to tell them all that information.
Thank you.
Anybody else? Right. I'm not seeing any other questions. I know that Abby's email is on here. Most of you already have mine if you don't. So if there are questions that come up, please feel free to let us know. Oh, Heidi's typing, so we're going to hang on a second. She is muted, and her daughter is studying or taking the AP test right now. So we'll wait for her to finish typing. Helen Wilson is asking, are you doing anything with Casper? At this time, we do not anticipate doing anything with Casper. The changes that we're implementing this year with virtual interviews and the whole, you know, travel restrictions, we think that was enough of a change for us rather than throwing something else in the mix. So we will reevaluate everything. AMCAS still is working on situational judgment tests. So that could come up in the future, but that would definitely be for, you know, 2022 or later. So Heidi Lang's question is, are the virtual MMI conversations after the official scenario questions done also scored or part of the rating? How do you ensure that you do not score the non-MMI part? We're very, very open with telling them that they will not be scored on that part. It is strictly just to keep things moving. In the past, we did it because they couldn't enter the next station. This year, we may cut it off altogether. So right now it was just involved training our MMI people on how they score. Nicole asks, are students who have their MCAT score going to be at an advantage over students who do not because their dates have been pushed back? Avi?
No, we will not discriminate for students that are going to be taking their MCAT later this year. I think if you can call it an advantage, I think it's just going to be that they'll have their completed application already set to go before they're given an offer for an interview. That's the only quote unquote advantage that they may have, that they might have that in a quicker capacity. But otherwise, we're not going to discriminate against any students that are going to be taking it this year. And in fact, as we've kind of mentioned, I mean, we're going to be pretty flexible and things are very tentative at this point. So if there are additional dates that are going to be coming up, we will change them accordingly. One thing that I think is also a very strong point for us is that our application deadline has always been at the end of the year. And so already given the fact that we have such a late deadline for students to apply to us, we're hoping that that's going to limit a lot of the causality that's going to occur because of these delayed MCAT dates.
Catherine has a follow-up question about EDP applicants. Is there a different MCAT date cutoff? No. As of right now, I believe that we have indicated August 4th as the last day we can receive an MCAT score for early decision. I say August 4th, that happens to be the Tuesday. MCAT scores were always released on Tuesdays. If that remains the same, that's why we say August 4th, but it will not be August 1 because that happens to be a Saturday. So that's the only change that we're making for the MCAT date cutoff for early decision. And if there is nothing else, we're going to pass this back over to Abby and he can close for us.
Thanks, Don. So again, thank you guys all so much for coming by today. Again, you're an extension of ourselves with all of our students. And so it's really thrilling for us to have the opportunity to speak with you in regards to a lot of these updates that are coming through at Wayne State. Understandably, I mean, everything is going to be in flux for quite some time. And we're really looking forward to having a much more streamlined communication stream with you in regards to a lot of the updates that we're going to be coming up with. So please stay tuned and stay in touch as well. As you can see, like my email is over there. And, you know, you should, if you'd like to follow up with Dawn or anyone in admissions, you know our email as well. And we're pretty responsive. So keep us posted if there's any questions that come up, and we'll be in touch with updates soon. Thank you all so much for coming by today. And with that, we'll close for today.